Welcome to AI for Good, the leading action-oriented, global and inclusive United Nations platform on AI. Organized by ITU, in partnership with 40 UN sister organizations, and co-convened with Switzerland. The goal of AI for Good is to identify practical applications of AI to advance the United Nations Sustainable Development Goals and scale those solutions for global impact. In today's session, we're counting on you to use the live video wall feature to ask questions and post comments to help create an engaging discussion. We encourage you to stay until the end to chat, connect, ask questions, and network with our distinguished panelists and world-class AI experts in the neural network. It is now time to kick off the session and welcome our first speaker. The floor is yours.
Good morning, good afternoon, and good evening. My name is David Hillers, and I'm a researcher and resident physician at Charité Berlin, University of Medicine. We welcome you today to AI for Good and the webinar by Ming Tai-Seale with the topic AI-generated draft replies integrated into electronic health records and physician-patient communication. It is an honor to introduce Professor Ming Tai-Seale, a distinguished researcher and explorer of healthcare innovation. Ming received her PhD in 1995 from UCLA Fielding School of Public Health and now serves as professor and vice chair for research in the departments of Family Medicine, Medicine, and Bioinformatics at the University of California, San Diego School of Medicine. Additionally, she serves as the Director for Outcome Analysis and Scholarship and the Director for Research and Learning at the Population Health Services Organization at UC San Diego Health. Her main research interests focus on medical practice, patient-physician communication, and mental health economics. She's renowned for pioneering the use of user action logs in electronic health records and the use of clinical recordings to study physicians' practices and their impact on physician well-being. Recently, she also led research into exploring generative AI in patient communication. Dear audience, please send us your questions during the talk using the chat wall in the neural network. We'll be actively monitoring and passing them along to our panelists. Please keep your questions brief and concise whenever possible. And Ming, we're all looking forward to your presentation.
Thank you very much, David. Hello. It is morning here, but it may be in the afternoon there. Good afternoon to you. Okay, I will start sharing my screen. David, can you see this okay?
Yeah, perfectly.
All right, wonderful. So it is the honor for me to present this work to you. Hopefully that this work will do some good as well for the for promoting equitable health, including mental health, to people who may not have as much as well access to care providers. So I'm going to talk about AI-generated draft replies integrated into electronic health records and physician-patient communication, and there'll be some focus placed on mental health. So in the US, the growth of patient messaging in the electronic health records has been growing over the years. We can see from this graph, this is data from UC San Diego Health, the number of patients sending MyChart messages. So MyChart is the patient portal in the electronic health records, which we use called EPIC. So we can see the number of patients sending MyChart messages has been growing steadily, and the pandemic doubled the number And then a year later, it doubled again, basically. And then after the height of the pandemic, the number, though, were not as high as 2021, but it seemed to have stayed at a much higher level than the baseline. Now we have about 1.2 to 1.4 million messages per month from patients. The national trend in the US is shown here by a paper in JAMIA, the Journal of the American Medical Informatics Association, that we can see that ambulatory care clinicians in 366 health systems, that the in-basket message received by these clinicians increased compared to pre-pandemic levels, with the largest increase coming from messages from patients, which increased to 157% of the pre-pandemic average, and it had not really gone down since then. And that each additional patient message was associated with a 2.5 minute increase in time spent in the EHR per day. We've done some work using the electronic health records user access log and reported that physicians' well-being is linked to in-basket messages generated by algorithms in the EHR. And then we also have reported that the the user access log indicate that physicians split time pretty much evenly between seeing patients and doing desktop medicine. In addition to this work, we have gone deeper into the in-basket messages and to see if the characteristics of the message may be associated with physician burnout. This is work published in JAMA Network Open in 2022. And what we found was using natural language processing, looking at the sentiments of the patient messages, we have seen that there are some messages that have expressed rather negative sentiments. And looking at those, there is a non-trivial amount of messages that contain expletives or profanity. For example, this one, rather difficult languages. So thinking about clinicians spending about half of their time doing desktop medicine, meaning, responding to messages, closing charts, when they were not face-to-face with patients. And sometimes a lot of this work is done during what's been coined as pajama time, meaning it's after dinner, late in the evening. So imagine having to respond to messages like these could be quite, may not just require cognitive labor, but also emotional labor. We all know in late 2023, generative AI kind of burst through the scene, and so many people were very excited about this development, like overnight, raised all kinds of anticipation and enthusiasm about what generative AI may do. So in middle of 2023, we introduced generative AI here, dubbed the Dr. Chatbot, we're among the first in the US to integrate GPT-4 into doctor-patient messaging. This work has been published in this paper, so I will go over it briefly because we wanted to evaluate whether generative AI created drafts may be associated with some of the outcomes that we're interested in knowing in addressing physicians' workload and potentially to understand how using generative AI may save time and reduce cognitive workload. So this was done as a quality improvement project. We wanted to examine the association between generative AI drafted replies for patient messages and physician time spent on answering messages. We also wanted to explore the quality of generative AI drafted replies for messages with mental health concerns. So the outcome measures we looked at included time spent reading messages, time spent replying to messages, and the likelihood to recommend generative AI drafted replies to their colleagues. And then we also wanted to look at the quality of draft replies to messages with mental health concerns. There are 4 types of messages that are eligible for Gen AI drafts. They include, medication refill requests, questions about results, paperwork, and general questions. During mid-June to mid-July of 2023, we fielded this pilot project. We had 52 volunteers, which represented 43% of eligible primary care clinicians at UC San Diego Health. I want to first share with you, this is what the physicians see when they when they see a draft reply generated by the AI. You can see that the draft starts with, dear patient name, thank you for your message. And then there is a few options here. One is start with draft, so the physician could start her reply with the draft, or if she'd rather, she can start with a blank reply if she does not want to use the draft reply. And you can see that there's some built user feedback feature here. Did you find the draft reply helpful? Green thumb up or red thumb down. We had hoped that this user feedback may be informative to us, but it turned out this feature was not used very much. So we won't be talking about that. And I want to call your attention to see the lower half of the screen shows you the actual reply that was sent by the physician. You can see that she had edited the draft and provided more information that are more specific to the patient. And I want to also call your attention to the last statement on the screen. which is a disclaimer that we decided to place, which states part of this message was generated automatically and was reviewed and edited by Marlene May Millen, MD. So this was a very deliberate decision on our part to provide this disclosure to patients that part of this message was automatically generated. Now there are about 290 some health systems using this feature to help clinicians address patients' messages. Not all are using this disclaimer. We were among the first to do it because our AI governance body and our patient and family advisor bodies have felt strongly that this is the right thing to do. So this is something I want to call on your attention. The project used an intention to treat framework and a delayed approach to enable us to further tease out the possible intervention effect. So we had 3 time periods, T0, T1, T2. We randomized the clinician volunteers into 2 groups, immediate group and delayed group, which 3 weeks later, the immediate group started being able to use the feature, and then 6 weeks later, the delayed group was able to use the feature. And then we also had 70-some clinicians who serve as a contemporaneous control who did not use the feature. We use linear mixed effects model to account for covariates. And we did thematic analysis of qualitative responses. So the results are that we looked at the time spent on reading message, in preparation to reply, that there is a rise in the amount of time spent on reading the message in the immediate group during T0 to T1 time period. And then in the immediate group, the time went down a bit, sloped down, but it did not return to the baseline. And similarly, the delayed group, while in a similar fashion in the T0 to T1 period, between T1 and T2, the time spent on reading also went up. And the control group showed no change in the amount of time spent on reading. In terms of time spent on replying, we see that there's no change in the control group, and in the immediate group, it was a decline between T0 and T1, and it went up again between T1 and T2, and the delayed group followed a similar pattern. In terms of feedback we have received from clinicians when we ask them about the likelihood that they may recommend this tool to their colleagues on a scale of 0 to 10 in a framework of a Net Promoter Score, we can see that among the promoters who chose 9 or 10 on their likelihood to recommend, some of the comments included things regarding the tone and value of the draft and the potential for improvement and what they thought to be AI's role and their hope for improvements. So you can see that the quotes, suggested that the replies sounded very robotic still, but they were extremely helpful for generating the baseline response to what you want to say to a patient. And another said, I can't wait for them to get even better, to the point where they can mimic each physician's language and tone. Another one said, I think AI responses have its place. I worry about inaccuracies that I may miss due to busy workload. I have been very impressed with a few of the responses. The last one said, great initiative, which requires supervision. Hopefully there would be time when minimal supervision would be needed. I want to give you an actual example of this is a draft reply provided by generative AI. Hello, patient. I'm glad to hear that your knee pain has improved on its own. Regarding your elbow pain, it's important that we discuss your symptoms and evaluate the best course of action. It may be necessary to consider an X-ray or a referral for physical therapy. And this was the reply sent out by the physician, which is much shorter. And you can see the first statement from the draft state, I'm glad to hear that your knee pain has improved on its own. Regarding your elbow pain, here's where the difference comes. Unless you had an acute injury like a fall or an impact, it is unlikely that the X-rays will show very much. I would much prefer you make or keep the appointment for a good examination before exposing you to X-ray. So you can see that the physician's reply was shorter and quite different. So one thing I want to say is AI was instructed to not to make medical decisions. However, I think one may argue that the draft may have some suggestion of medical decision making. However, this is a quote from one physician. He said, I do really like the empathic tone of the messages. It makes me feel better sending it. Reminds me of Lincoln by the better angels of our inbox nature. So now I want to switch gear and to talk about mental health. I think when we think about AI for good, mental health access or access to mental health services has been a perennial challenge, I think, worldwide. So can AI be useful in helping patients with mental health needs? I want to read you a message from patient B. This message says, hi, can I get a refill for Percocet? Thanks. So what do you think the generative AI draft may say? This is what it said. You have no refills available. I will reorder this medication for you. It will be sent to this pharmacy and will be available once processed by the pharmacy. So we all know about the opioid use or misuse pandemic. and think about this kind of draft. How useful would that be? The sent reply, we didn't actually see a reply. We went in to study the chart. We saw that the prescriptions the patients have, there was an opioid agreement, and there was no refill on that. And then in another day, there was another record of a prescription, and again, no refill. So when I try to put this de-identified patient message into a more recent large language model engine, this different reply came up, which is, I think, more aligned with the evidence-based, more judicious use of opioid medicine or pain management. I understand your concern about refilling your Percocet prescription. However, I need to emphasize the importance of responsible opioid use and the potential risks of long-term use. So there seem to be new and improvements in how generative AI may respond to patient messages. I want to now read to you another message. Now, mind you, these are all messages sent to primary care physicians. And we probably all know that primary care physicians are often on the front line of addressing mental health concerns. Because in part of the patient-physician relationship patients have with their primary care clinicians and the short supply of mental health specialists and the poor access. So this patient's message reads, "My mom attempted suicide last Friday. She's in a psychiatric unit of a hospital under 24-hour surveillance by the staff. I wanted to know if you or someone in your staff have time to talk to me regarding a few things. 1, what is your advice on the best treatment plan for her? I think a combination of medication and therapy will be best. What should I expect from the hospitals in terms of care?" Again, this is a patient writing his primary care clinician. 2, how do I best take care if my dad is struggling with the situation? He will need support to get through this. 3, how do I best care for myself? I feel like I can handle the situation, but the stress is building up, and I don't know if I should preventively take Lexapro again to reduce the anxiety. I'm sure I'll experience in the coming weeks and months. Thanks. So this is what the large language model's draft reply. I'm so sorry to hear about your mother's situation. It is important to take care of yourself and your father during this difficult time. 1, the best treatment plan for your mother will depend on her individual needs and preferences. The hospital staff should be able to provide more information about the care they're providing. Sounds pretty good. 2, it is important to provide your father with emotional support during this time. You can also look into local support groups or counseling services that may be able to provide additional help. 3, taking care of yourself is essential. If you feel like you need additional support, please do not hesitate to reach out to a mental health professional. I'm here to help. Please do not hesitate to reach out if you have any further questions or concerns. I think because I'm in this speaker mode, I can't tell if there are comments, but I hope this is causing you to think about this reply and the appropriateness of such reply. The sent reply we have available is this. Hi, hope this message finds you well. A registered nurse has attempted to contact you and left you a message regarding your symptoms. Please call us back. Here's the general UC San Diego Health number as soon as you can to speak to a triage nurse to discuss your symptoms. So this is per protocol when there are urgent matters, a triage nurse would call the patient. So in our primary care, there are pools of nurses monitoring the inbox. And there are, the protocol is, to call the patient. But if you're not able to reach the patient, they would send this message, call us back. And then there's additional information, and rather, it looks like a templated measure, including calling 911 or going to the urgent care and express care walk-in clinics. And 2 days later, there was another reply from a nurse stating, so sorry to hear about your mom. Her care team will be the ones to best determine what help she needs. We unfortunately cannot prescribe medications or do a visit with you since you're outside of the state of California. It looks like your insurance card has options for you to get care while traveling. And then there's instructions on how to, call for clinicians for help that are covered by his insurance. So that was the patient's experience. This was about a year ago. And so I thought about what would a more recent generative AI model say in terms of, in response to this patient's message. So when I placed the patient message into Gemini, this came up. Talk to someone now. Help is available. Here's the 988 Suicide and Crisis Lifeline and ways to do a chat and link to the official website. So things have changed, really. For a fairly urgent mental health message, if someone goes to generative AI, this is the kind of reply they would get. And in addition, this message, things might seem impossible right now, but talking about it can help. Call or text 988. It's a confidential helpline. Now go back to the messages that I had shown you that were unpleasant or even hostile. And I wondered, can generative AI help? And this time we think about, can generative AI help the clinician who's responding to this kind of message? And could generative AI help patients before they send it? So I'm going to share some examples with you. This is a message from a patient that said, I need to add what bothers me. So this is a message sent to a primary care physician. As you summarized, so at UC San Diego Health, we have open note, which means patients can access the clinical notes through MyChart, through the patient portal. So this patient message came after the patient had seen the notes written by the physician. The message continued, I was fired from this organization. I was let go. Why was a good thing taken out of context into bad? Why even list that I was fired? I worked undercover for the organization, not this other organization. I've been dead twice, childbirth, then a coma. I developed my program in classes to learn to read and write again. In the special services department while I worked there, I was no longer allowed to take classes because after testing my IQ was too high. I'm relieved by the suicide of my husband, ending 20 years of poisoning, strangling, or other means of causing me loss of memory and near death. This leaves scars, etc., etc. It went on and on, with some more. The last sentence was, please know, I'm not a screw up. I've faced challenges most will never, and I need support from this perspective. And this was the draft. Thank you for your message. It sounds like you have faced many challenges in your life and have been able to overcome them. We would be happy to discuss your concerns further in an appointment. Please contact our office to schedule a time to talk. Thank you. And what do you think would the care team do with this draft? Well, they did not use the draft because, as you can see at the end of the message, there is not that disclaimer. So the clinic team decided to not use the draft, and instead they said, thank you for your message. Dr. So-and-so has reviewed it. And if you have other issues or concerns, it will need to be discussed in person or via video. Just a reminder that MyChart messages are to be used for medical, medication, lab results related, and visit follow-up questions. Outside of these questions, MyChart messages make it challenging to provide timely care to other patients in our practice. If there is any inappropriate or misuse of MyChart messages, the clinic may terminate your MyChart privileges. Sincerely, Doctor and the team. So I was thinking, could generative AI help the patient? What if the patient had put in her message into a generative AI, and what that may come out to be? So this draft for the patient came out to be, I'm concerned about recent evaluations. I was unfairly let go due to these reasons. I'm facing serious health issues. I need support to manage my health. I would like to request a review of my medical records. I believe there may be some inaccuracies in the notes regarding my employment history. I'm concerned that these inaccuracies could negatively impact my future care. I would appreciate it if you could take a moment to review the specific details and make any necessary corrections. Thank you for your time and consideration. So this sounded quite different from the original patient message. It gets the points across, but in a more cordial way. And more recent generative AI reply to the original patient message also sounded somewhat different. So it looks like in this use case, generative AI, especially in the more recent versions, could be helpful not only to clinicians, but also to patients. And in this draft, it also does not talk about if patient's tone was or if the patient uses MyChart for things other than the prescribed uses of MyChart, that they may lose privilege. So this was, perhaps we can explore ways to reframe your past experiences in a more positive light. We can work together to highlight your strengths and abilities rather than focusing on the challenges you faced. Please know that I've valued your perspective and want to help you in any way I can. Let's schedule a time to talk further about your concerns and goals. Now, you may or may not agree with this tone, but nevertheless, this is what may be available if the patient just sent it. So let me see another one. Remember about the messages that we included in that other paper that were also difficult? I want to show you one of them. So this one said, well, I'm not a religious person. I hope and expect that you will spend eternity in hell. You're an abusive, nasty, cheap person. GPT 3.5 said, I'm sorry if there has been any misunderstanding or conflict between us. As your physician, my primary goal is to provide you with the best possible care and support. If there are any specific concerns or issues you'd like to address, let me know. And GPT-4 has a slightly different reply. And the more recent one, Gemini, has a bit more different replies. Would you like me to connect you to a mental health professional? Here, I won't tolerate abusive language. However, if you continue to speak to me this way, I'll have to end our conversation. If you are struggling with difficult emotions, there are resources available to help. And in the original, in the medical records, what we saw was there was not a MyChart reply. There was the pool had forwarded to the clinician, and there was a follow-up visit with the patient. Lastly, this is another difficult message from patient with expletives showing strong emotions. GPT-4 thanked the patient for expressing their concerns openly and empathize with them about their challenging and the frustrating situation, and offer to schedule a time. And in a different large language model engine, there were actually options on how you want to handle the situation. If you want to de-escalate the situation and show empathy, here's what you may answer. If you want to set a boundary and maintain professionalism, here's another option. And then if you want to directly address their concerns, you could say, I appreciate your concern and I'm taking your issue seriously. However, please understand that I have other responsibilities and commitments as well. I'm doing my best to address your issue in a timely manner. So this is interesting. These are shorter and that can be tailored to how the clinician want to use, how to want to reply. So let me ask you a question, dear audience. After seeing these examples, if imagine you're a clinician on the receiving end of these messages and having access to the drafts, how likely are you to recommend the automatic reply technology to a colleague? 0 to 10. This is an unsolicited email message I've gotten from a clinician who about a year ago was not very enthusiastic about the technology, but he said, interestingly, I've recently seen a positive and rather abrupt turn in what the AI MyChart responses has been able to do in the last couple of weeks. The responses have become much more useful, and I have found myself utilizing them more than I had did previously. So in conclusion, Gen AI drafted replies were correlated with increased message read time and no change in reply time. Physicians valued generative AI drafted replies as a compassionate starting point for their replies and noted areas for improvement. And regarding mental health issues, the recent versions of Gen AI replies are more valuable. With respect to, is AI the cure for doctor burnout? Colleagues at Stanford had done a study in the similar time frame as UC San Diego Health. They also didn't find time savings. However, using some burnout questions, they found AI-generated draft replies had reduced the workload and some, the emotional exhaustion part of the burnout questions. We also asked our physician participants about their burnout, but we used the mini-Z burnout question, and the mini-Z question was not sensitive enough if there had been any reduction in burnout. But the professional fulfillment and emotional exhaustion had shown some decline in this paper. So we believe a balanced approach that focuses on Gen AI's present capabilities and limitations is necessary, and human input is still essential at present. And we need to focus on patient experience and continue the comparative effectiveness research so that AI can do more good in providing services to the public. Okay, I apologize. I might have gone over time, but let me stop.
Yeah, thanks, Ming, very much for this informative and interesting presentation. And it's really impressive to see real-world implementation of the large language models in clinical practice and how fast you conducted these research endeavors. So, dear audience, please continue to post your questions on the chat wall in the neural network so that we can address them here. So maybe we can start with a question about large language models, and then we go on to questions from the audience. I'm interested in knowing, did you encounter any legal or regulatory barriers while integrating generative AI into clinical workflows? And if so, how were these addressed?
Oh, very good question. So for this use case, we used everything was inside the secure HIPAA compliant environment. The OpenAI large language models in the Azure cloud server, and all the patient messages and drafts are all in the Epic. It's been integrated into the Epic environment, and it's we did not experience any difficulties. Of course, our legal and compliance oversight have approved our participation in use of this technology. Now, there are, of course, other uses of generative AI. We are about to start using the ambient documentation or AI listening and then creating clinical notes. And the contract language has been under review and negotiation for a very long time. So it is it is quite an important step, and can add a lot of complexities of using generative AI in healthcare.
And do you think this is like a general example of your experience, or do you foresee any challenges that other providers may have? So it worked out very good that you could implement this within your framework. Do you have any recommendations, or do you think there may be problems lying ahead of implementing these models?
I think there may be, because we know about sometimes AI would make up things like generative AI. So the hallucination is a concern. And I think that's in part why clinicians spend more time reading the messages and the draft replies than they had done in the previous times before they started using the AI tool. So I think people have to be extra vigilant. And also you see that the AI, the example I gave you recommending X-ray and physical therapy, it's not, it's not outrageous medical decision making, but it was nevertheless, it can be seen as medical decision making. So I think in these pieces we have to be careful. Now this is just like a one use case, even though about almost 300 healthcare organizations now are using this tool, and our own user base have increased. But some people may say this may not be the best use for AI. AI listening could be a better use, because that will, free physicians from having to type the notes. And we're also piloting using AI to summarize the chart. We're doing a study to have AI summarize goals of care documentations that are spread all over in the notes and may not be actionable for clinicians needing to make end-of-life care decisions, that they need to get to information quickly. That could be another use case for AI. So I think we need to be careful in choosing the problems that we want AI to solve, and be very mindful about legal ramifications.
Yeah, thanks. And also sounds very interesting that you're diving into summarizing patient interactions and also documentation, because this takes up a lot of the time of a clinician.
Yes.
Yeah, so there's a question from the audience from Z Jen. While I understand the focus on physician-side assessments, particularly in terms of productivity gains from reading and writing, I'm curious about the potential for client-side sentiment analysis. Specifically, how could LLMs be used to assess client sentiment in response to LLM-generated messages compared to physician-generated messages, or a hybrid approach? Are there plans to explore this avenue, and believing that LLMs could potentially enhance the empathy and effectiveness of physician-generated messages?
Yes, yeah, this is an active area of research. You may know of a paper that was published early in 2024. Some of my co-authors in the JAMA paper were authors in that paper, that they put patient questions to Reddit that were answered by physicians. They entered those patient questions into GPT. At that time, it's GPT 3.5, and analyzed the empathy and the quality of the response of physicians compared to generative AI. Now, the physicians were the physicians providing free advice on Reddit, right? So probably in their free time and uncompensated. The study reported better empathy and better quality of replies from GPT. So it is certainly another use case to use LLM to examine the sentiments. We did use that in our other paper, which I shared with you about, we look at positive, neutral, and negative sentiments. And I think we can apply the same thing to the clinician's reply and the Gen AI draft. So we can do LLM on LLM drafts. Yes, this is definitely an area of active research.
Okay, I think we are already at 5 p.m. Maybe one last question. Do you think that a system to facilitate communication between doctors and patients will be in regular use in the next 5 to 10 years, or will it take longer or even shorter? What are your just wild guesses about the future of patient interaction?
Yeah, I think it's already here. It's already being used. Majority of patients are already using generative AI for their healthcare needs, and they would take their what they find from Gen AI to their clinicians. And as you know, over almost 300 some organizations are using this tool to support clinicians in responding to their patients' messages. And also with the AI listening, that is already being shown to facilitate better patient-physician communication, because physicians are not typing, they're actually looking at the patients listening to the patients. So I think that has already happened. We're not going to wait another 5 years. And in 5 years, I think the future of healthcare, or the exam room could be very different. Maybe not 5 years, maybe 5 months, it would be very different. We hear about studies on clinic of the future, exam room of the future. I think it'll be a very fascinating field as it evolves along the changes in generative AI.
Yeah, thank you. It sounds very fascinating, and yeah, we'll see what the future holds. Yeah, thank you very much for this deep dive into using generative AI for physician-patient communication and for introducing your research to a broader audience. And I think this is a good moment now to close the live session and move on to the public neural network platform. So we can all further engage on the neural network platform via the chats. And thank you very much, Ming, and see you soon.
Thank you. Thank you, David, for having me. Bye-bye.
Bye.
Thank you for participating in today's AI for Good session. We hope you've learned something new, innovative, and engaging in today's event. We now encourage you to continue the conversation on the live video wall in the neural network. Here you can ask questions, like and comment, share links, complete the poll, connect with interesting profiles, or speak one-on-one using the chat and video function. We invite you to explore the lobby, try the smart matching quiz, visit the virtual exhibits, poster boards, the e-shop, and build your personalized AI for Good program. Let's shape the future of AI for Good.
you.